Differently abled, differently.
Welcome back. Recently, the Ministry of Health announced the resurgence of polio virus, which had been eliminated before. All efforts are now geared towards vaccination and public awareness. Take a look.
Polio, a highly contagious viral infection which had been contained earlier in Kenya, has resurfaced.
In 2013, we had a polio outbreak in Garissa County. As a result, 14 people were paralyzed, and sadly, we lost 2 lives. As a ministry, we are cognizant that our population remains at risk as long as cases continue to be reported in the 2 endemic countries. The country has had 6 outbreaks since 2005, which were linked to ongoing outbreaks in our neighboring countries. On the 22nd of June this year, we received a notified of isolation of polioviruses from samples collected from 3 children in refugee camps in Garissa. As of today, we have isolated polioviruses from a total of 6 children in Garissa County, all of which are linked to other viruses detected in the neighboring country. So this polio, if we do not take it seriously, it will treat us seriously.
The disease was a global epidemic and was eradicated in many countries through vaccination.
2 years ago, the Afro region was declared polio-free. And since then, there have been some misconceptions about the polio eradication initiative. People tend to think that the work has already been completed. Unfortunately, there are still some countries that have been mentioned here that are still endemic, and wherever you have the polio virus, it does not recognize borders. So even though the African continent has a polio-free certification, viruses can still be imported across the border.
Polio, which is short for poliomyelitis, is caused by the polio virus and affects children under 5 years of age, causing paralysis and even death.
I was told that polio caught up with me when I was already working, and that means I was told by my mother that I worked very fast at 10 months, and after I started working, then the polio came. And because of my mom, it didn't keep me down. She did everything to ensure that I grow up to a human being. I was her last born. So in our place, the last borns are regarded as very close to their mothers. And she did everything. I can remember when I was very young, there used to be a hole, because you know, there are so many people in the village who are advisors and medical ones for that matter. So people used to tell my mom that now that you have a child who has been crippled and cannot go to school, then you need to dig some hole and be putting him there so that his legs can be straight and he can walk.
The funny thing about polio, it cannot be detected like immediately. So they think you have a pneumonia, they will think of everything that particular time. And my mom said that when they were told that your child will never be able to walk again, she could not believe those words. But that was the truth. And she went and broke the same news to my dad. And my dad said, no, that cannot be true. And where I come from, our culture looks at disability as a curse, as something that you have affected the gods, the parents have broken a taboo. So that means this child must be locked in the house so that they don't lose their status of belonging in the society.
In Kenya, the last known polio case was reported in 2014 as a result of tireless efforts by government, organizations like World Health Organization, UNICEF, and Rotary International.
We're part of a global organization of 1.2 million members in over 200 countries and 46,000 clubs. So while we work as ourselves, we do have collective initiatives, global initiatives, and our number one global initiative is the eradication of polio. It's a process that we have been on for over 30 years.
We support mainly in the Horn of Africa and the border counties, and also within the country overall, where we are able to support surveillance, ensuring that the waters are tested in case anyone has any features of what we call acute flaccid paralysis. That stool is tested, and we're able to detect polio as early as possible if it's there. And with that, we are also able to ensure that everyone is screened.
What we seek to achieve is really to get acceptance at ground level, to get parents to bring forward their children, not just for the first vaccination, but for the 4 that are required really to have a permanent immunity against polio. That a child that's immunized will prevent them from passing it on to other children.
Recently, new cases of polio have been reported in Garissa.
Our immunization coverage stands at 80%, but that national figure masks the disparities and inequalities that exist, especially in the northern arid lands. For example, the figure for Garissa, where the current epicenter of this outbreak is 17%. So it means out of 10 children in Garissa, it's probably only 2 who are fully immunized. If you look at Kiambu, where we're situated today, 4 out of 10 children are not fully immunized. Kajiado is 6 out of 10. Nairobi, 6 out of 10, Nairobi, the capital city, are not fully immunized. And we have a proportion of more than 300,000 children who have either not been vaccinated or are not fully vaccinated. The ones who are not vaccinated at all, the ones we call the zero-dose children, is 45,000 every year. Those pockets of children who are not immunized then pose a huge threat to others, even those who are immunized.
We take it forward by ensuring now we achieve higher and higher and come up with innovative ideas. I don't mind you going out there, Waziri and the team, benchmarking against other counties. Quite a few other counties are doing far better than us in the country. The team here from the national government is here. Also, the national government, the health department is quite supportive. They are willing to give us all support we require. Let's go out there and ensure we come out. This year is the decisive year for our county.
In response to the resurgence, health officials and organizations have embarked in mass vaccination and awareness campaigns in order to contain the spread of the virus.
It is for this reason that we have planned to mount a response to interrupt further transmission of the virus. Polio vaccination campaign being launched today will be conducted in 3 rounds. Round 1, we are going to target the 4 high-risk counties, starting with Garissa. Other counties that we are targeting here will be Kiambu, Nairobi, and Kajiado. In this round 1, we intend to reach 1.8 million children under 5 years. Round 2 and 3 will be conducted in September and October, targeting more than 5.6 million children in the other 4 counties and additional 6, which are Lamu, Tana River, Wajir, Mandera, Kitui, and Machakos.
We need to ensure we get the highest value from this exercise by reaching the farthest corners of our villages. Similarly, I call upon the media, some of them are here, pia mtusaidie kuhakikisha kwamba this information about this campaign reaches the farthest corner.
This unexpected challenge is a reminder that the fight against polio is not yet over. Hence, the need to maintain high vaccination coverage and stay alert against infectious diseases.
To ensure that this campaign is taken very well to the villages so that our people can be well informed about it.
To reach all these children, vaccination teams will be moving from house to house, vaccinating all children under the age of 5, irrespective of their current vaccination status.
We have to revise our approach, in my view, to these challenges, so that we make it a sustained campaign. And in this work that we are doing, I want to propose that I believe the sensitization, the awareness creation must move at the same pace with the vaccination. Because what ails us more, in my view, is the fact that we lower the levels of alertness and awareness as we continue or get into flow with the other aspects of life.
Let's take a look at the UN Convention on the Rights of Persons with Disabilities.
Article 25 of the UN Convention on the Rights of Persons with Disabilities states that state parties shall, Part B, provide those health services needed by persons with disabilities, specifically because of their disabilities, including early identification and intervention as appropriate, and services designed to minimize and prevent further disabilities, including among children and older persons.
And this is the tip for the day.
Despite even having a mental health condition, you can actually achieve recovery. And recovery is actually personal, because there's someone else who may say their recovery is actually not having the condition. Someone else's recovery is actually, the condition does not affect your life. So you have to first identify what recovery means for you, then purpose to achieve that recovery. And my quote that, I have a quote that I tell myself, and that's what I use for advocacy. It's that by speaking up, I break free from the stigma grip, because stigma is what hinders us from reaching out for help. When I broke the stigma and chose to perceive mental health as a normal illness, then is when I started getting help. So I'd like to tell them that reaching out for help is the first step to recovery.
We are here and we are strong. Let's be counted as we move on. Make a difference, change lives as we tell our different stories. We are capable, beautiful. We are born to do great things. We're unstoppable, incredible, 'cause we're differently abled, differently.